Welcome to the United Way Difference, a program that discusses Oshkosh community needs and how local nonprofit agencies are supporting people in our area. United Way's focus in the areas of income, education, health, and volunteerism helps to build a stronger, more caring, and compassionate community. The United Way Difference is brought to you by the Oshkosh Area United Way.
Hi, and welcome to the Live United, United Way Difference. This morning when I was getting ready for work, I was listening to the news, and then when I was reading the Oshkosh Northwestern, there was a report that 9 of the top 20 cities in, I gotta say this right, 9 cities in Wisconsin are among the top 20 drunkest cities in America. And the reason I'm talking with you about that is the data was taken from a Delaware company using the Robert Wood Johnson Foundation information and information from the University of Wisconsin Population Health Organization. So it's good data. And then the CDC later on reported that binge drinking or binge drinkers are 14 times more likely to be involved in alcohol-impaired driving. So again, the reason I'm bringing this to your attention is that my guests today are Sarah Mundi from NOVA and Chief Kurt Leibold from the UW Oshkosh Campus Police to talk with us today about the Winnebago County Drug and Alcohol Coalition. Welcome to the program. Thanks for coming here.
Thank you.
This is a pretty heavy topic, and then it just seemed so odd this morning knowing that we were going to be taping this program that this report appears. First of all, I know, Kurt, you said you had an opportunity to see the report. Did anything surprise you?
You know, it really didn't. The only thing that surprised me is there were so many Wisconsin cities in the top 20. You know, this is, if you talk to anybody in law enforcement, they're going to tell you that they see this on a nightly basis in our cities. I'm new to this region. I've been here about a year and a half now. And it did surprise me the amount of drunken driving contacts that my officers have, the university officers have, in such a small jurisdiction within Oshkosh. Just some statistics, we had 61 drunk driving arrests from my officers, and my jurisdiction is within the city of Oshkosh, so it's just a small piece of it, and that's a big number.
And let me ask, so you said 61?
Yes.
And those weren't necessarily all university students?
Actually, the majority of them weren't university students.
So they were not
They
university.
were citizens just driving through our campus.
Okay. You know, I think it has a lot to do with, you know, we've been hearing a lot about Wisconsin's culture and the culture of drinking. Sarah, how does that translate into other drug use then?
Well, I think it translates into other drug use as it can be a stepping stone, the alcohol. I think it impairs judgment to the point where it invites the other substances to be a consideration for a lot of people.
Okay.
Whereas if they were not drinking, they may not choose to use the illegal substances that are available.
You know, you always hear that alcohol, you wouldn't do the behavior anyway, and so you can't blame it on the alcohol, but if it impairs your ability to make good decisions, I would think that that would make it more difficult or to make a good decision, but easier to make the poor decision.
Correct.
Okay. As we move forward, I want to really talk about the Winnebago County Drug and Alcohol Coalition, which is what now it is called. And so we're going to be flipping through some slides that will come up on the screen to share more information about that. So right now we are called the Winnebago County Drug and Alcohol Coalition, but that wasn't always so, correct?
Right. We started out back in 2013 as the Heroin Task Force. And that task force was formed after an alarming rise in heroin related overdose deaths at that point in time. So it actually quadrupled from 1999 to 2013, the opioid, how many opioids were dispensed in the U.S. So it kind of was in response to the Joint Commission having pain as one of the factors that was listed on, like, the doctor's scale. And in response to that, patients would say, like, you know, they rate their pain as 1 to 10, and that actually was kind of a factor in deciding like the level of care that you were receiving.
So they would get more prescription medication to take away the pain, and then they became addicted?
Correct. So a lot of times there wasn't that conversation on the front end that these opiates and these opioids that were being prescribed, there wasn't an education behind the fact that they were highly addictive. So you're prescribing them to young kids with sports injuries, people that just need a minor surgery, and you're having them leave the hospital with managing their own pain meds, and then some of them are becoming addicted to those pain meds, and then when they get cut off from them pain meds, they don't have any other substance to look for. They're looking on the street, they're looking for something to actually help them not be sick.
Okay. And I know you probably don't have any statistics around this, but do you think that another contributing factor might be that if, as a parent, the parent gets the opioids for pain and they don't need them any longer, and rather than getting rid of them, that they might have them in the medicine cabinet, the kids find them and say, oh, I'm going to try this?
Oh, most definitely. I think we've tried to assist somewhat in the Oshkosh area by having the drug drop boxes, but
and where are those located?
I believe there's one at the police department here downtown.
Okay.
Yes.
And it's confidential. You just drop them off. And I know that I've gotten something in the mail about being able to. How do you actually? You put the drugs in like a baggie or a Ziploc, and then you take them and you drop them into this very secure container, and then no one else can get into them.
Nobody else can get into them. And
But it's confidential. They wouldn't know it came from me or whoever.
No, and I think there needs to be more education about just, getting rid of those medications that you are no longer using, whether they're habit forming or not.
Right. I mean, you could do the same thing with vitamins or something else that are out of date. You don't want to throw them down the toilet because that screws up the water system.
Right.
Okay. So we had, with the heroin task force, how was it structured?
We had a 4-pillar approach. So we started with prevention, harm reduction, treatment, and law enforcement.
And we launched this at a big event, didn't we?
Yes. I think there was a lot of interest. There was a huge amount of people participating to see what the community was going to do in relation to this problem, because I know a lot of people were fearful. They were experiencing it in their own families and wondering what was our response going to be at the community level.
And how often does this happen in households? More than we think?
I think it's happening, and the stigma around drug addiction and alcoholism is so high that nobody really wants to talk about it because they don't know how to handle it when it happens to their family. It's like you don't need to know about those things until you really need to know.
Okay. And that's scary, but it also, I think, inhibits people from asking for help.
Oh, yeah. It's a huge gap for us.
So the opioid deaths, on the rise?
Overall prescription opioid drug deaths are kind of leveling off, and that's a good thing that's going on. The reasons why is because law enforcement is really cracking down on prescription drugs. Doctors that overprescribe are being held accountable. And you talked about those drop boxes. Those are having an impact. Getting those prescription drugs out of the house so kids don't have access to them is a great way to stop the kids from even starting to begin with.
I think the medical community has looked at this too, and how they prescribe now, and making sure that they are not overprescribing.
Absolutely.
So they've taken some responsibility too, because they would be the source of the prescription drugs.
Yeah, this has to be a holistic approach,
Right.
and we've made mistakes in the past in law enforcement where we treated this like it was a criminal matter, and drug addicts were put in jail rather than getting the treatment they need. And certainly drug dealers need to go to jail, but we're not going to solve the problem by arresting people that use drugs. So, but as far as the overdoses for heroin, that's going up. And in this county, we're averaging about 28 in the last 3 years.
Wow.
And what's disturbing about that is Narcan is so much more accessible now in the overdose reducing drugs.
Well, and talk a little bit about Narcan, because some of our people might not know what that is.
Narcan is a drug that reverses the overdose, and now most law enforcement agencies carry that with them. As a matter of fact, we have to keep it in our evidence areas because officers have been found to overdose just by being in contact with drugs like fentanyl. So if an officer starts overdosing, we have to have it to reverse the effects.
And it's administered to the person who's overdosing.
Yes, it is, and most of the time it's administered through the nose. But that
it's
is
like an
reducing.
inhalant?
It's an inhalant, yes, and that's reducing the number of deaths. So really, the numbers staying the same, but we're probably reducing a lot of those deaths that would have happened because Narcan's out there.
Are we? Do we know how many times Narcan is deployed, and are we tracking that?
You know, and that's part of our plan with this coalition is to start gathering data, and that's going to be one of the main points. We've applied for grants to get analysts in to bring Winnebago County data together. That's going to help us focus more on what our priorities should be.
Okay. This is our new branding for the Winnebago. So talk about how we went from the heroin task force now to the Winnebago County Drug and Alcohol Coalition, because that was a shift.
Yes, there was a shift. We shifted from the 4-pillar approach, and we put together a new mission statement, being that we wanted to prevent and reduce drug and alcohol use by empowering our community to affect individual and social change through education, advocacy, collaboration, and the coordination of resources. So it's a more of a macro level approach.
So not just focusing on the opioid use, but the alcohol and other drugs.
Correct.
Because did you just tell me before we met that something was it meth?
Yes, I was in a law enforcement collaborative community meeting yesterday, and one of the law enforcement individuals was telling me there's an uptick in meth in this area. And that can be because of many things. Heroin dealers maybe, getting arrested, and people are finding another substance, available, cheap, ready to use, highly addictive. So we're just trying to take a look at where we can be effective in our community to prevent some of these things and reduce some of these things from going on.
Okay, so we went from the 4-pillar approach to this approach now, to this new structure.
Yes.
Okay.
Yeah, and so our new teams are the prevention and awareness team, our treatment and recovery team, the data team, and then we have a communications team as well. And those teams all are, we're looking at a steering team to just increase the communication between the action teams and look at what we can do in solving the substance use problem in our county.
Now, this might be a little small for people to read. Plus, if you're listening to us on the radio, you're not seeing this, hopefully, because you're driving or something. But with the prevention awareness team, what's their role?
Their role is to prevent addiction and increase awareness through their proven strategies.
Okay. And we're talking about evidence-based strategies.
That is correct.
Okay. And treatment and recovery. We added recovery because before it was just the treatment pillar.
Right. And so we want to invite people that are recovering in the community to be part of these action teams because their voice needs to be heard as well. Their action was to increase access to treatment and develop strategies to bridge people from treatment into recovery.
And then Dean, you were talking, Kurt, you were talking about, we have Dean and Kurt both on. I get confused sometimes. Kurt, you were talking about the data. So do you want to maybe talk a little bit more about that?
Sure. The idea is to gather as much data as we can. So like I said earlier, we can focus on how we're going to prevent and deal with what our priorities are. Also, it's a way to measure our success. We want to make sure that we're actually having an impact in the community. So data is very important. And then the communication aspects of it is we need to give a voice to this. We need to make everybody aware all the time of what's going on. This is a community problem, and people need to be involved.
Okay, we're going to take a quick break here, and then we'll be back to talk about where you're going and a little bit about what's happening on the campus and also at Nova.
Sure.
Okay, thank you, and come back to our program for more information.
It's not a charity, it's more than a charity. It's about helping people we live with. It's about being the type of person that the 6-year-old version of ourselves wanted us to be. It's about community and looking out for one another. It's about money, yes, but it's so much more than money. It's about friendship and common values. It's about opening doors when others are slammed shut. It's about giving kids a place to be kids and growing up knowing they live in a community that cares about them. It's about making sure that everyone gets to see the dentist, because we want to make sure that they have every last tooth in those smiles. Ultimately, that's it. It's about the smiles, old smiles and new smiles. It's about us, all of us, our community living united, because great things happen when we live united. Will you join us?
Hi, welcome back to our program. We're talking about the Winnebago County Drug and Alcohol Coalition. My guests today are Sarah Moondy with the NOVA. She is the Marketing and Business Development Director over at NOVA, and Kurt Leibold, who is the Chief of the University of Oshkosh Campus Police. I'll get that out. I'll spit that out right. Kurt, we just ended with you talking about two of the 4 pillars being data and communication, and Sarah, you had talked about treatment and recovery and prevention. But in order to make all of this work, you mentioned that we have a steering committee.
Yes.
So the steering committee does what?
The steering committee's goal was basically to enhance the communication efforts between the action teams, access to funding, and just kind of oversee what's going on with the coalition as a whole.
Okay, and then in order to keep this going, we actually have 2 backbone organizations.
Correct.
And?
They are the United Way, which is our fiscal agent, and the Public Health Department, which actually they allocate one of their people as our coalition coordinator and some grants and supplies to help support our coalition.
And Stephanie does a great job keeping us all, it's like herding cats sometimes, I think, with this coalition, because we all have a real interest in it, but we all come from different places.
Yes.
And so trying to keep us all together as a cohesive group, and I think she does a great job with that.
Yes.
So let's look at some statistics about drug-related deaths. It looks like we had in Winnebago County back in 2009, and I apologize, this is a little bit small for the people on watching it on TV, but in 2009 it looks like we had 16 deaths. It dropped down a little bit, but then in 2012 it jumped up to 26.
Yeah, that's the trend nationally. That's just not Winnebago County.
Okay.
We're seeing that nationally, and it's taken off quite a bit from there as well. Like I said, having Narcan out there is really helping prevent the deaths, but it's a major issue that needs to be dealt with.
And so then it pops back down to 14, and now as of 2016, at the end of 2016, we had 28 deaths.
Yes,
and again, you mentioned that earlier too, and it could be more if we hadn't been deploying the Narcan.
I'm sure it would be.
So if people want to stay in touch with the Winnebago County Drug and Alcohol Coalition, how would they do that, Sarah?
We actually have a website at www.winnebago.dac.org, and we have a Facebook page, and you can also contact a number 920-420-6831. We have an email where you can access us.
Okay, and just to give you a little look at what the website might have on it, we have resources.
Yes, we have the treatment guide that can be downloaded, and when our meetings are.
Information about the action teams. Does it say what each action team is responsible for?
Yes.
Okay.
There's
And-
also a way for you to sign up and help us, and that's what we're looking for. We're looking for people to join the teams. Like I said earlier, this is a community issue, so we want the whole community to try and help solve these problems.
I think my big aha moment in one of the meetings was when either you or one of the other people in law enforcement said that we can't arrest ourselves out of this problem. It's more than just law enforcement.
And that's absolutely true, and we've learned that from history, and I dealt with it myself personally in the early 90s in Milwaukee, where I policed, dealing with the crack epidemic at the time.
Mm-hmm.
And law enforcement made mistakes, and what we ultimately did was contributing to ruining families and incarcerating people that actually needed treatment and jail wasn't the place for them. So we have to learn from those mistakes, and we also have to learn that it's a collaboration. Public health wasn't involved back then, and it should have been.
Yeah.
And now it is involved heavily in Winnebago County. And one thing that Winnebago County has going for it it's a real positive is the collaboration here. And it's better here than I've seen anywhere. So that's a good thing.
Well, and I think you need Department of Human Services, which you've already, they work well with the Department of Health, and then, Children and Families, and so it all comes together.
Absolutely. Nonprofits and all those agencies working together.
But even the collaboration between the Oshkosh Police Department and the University Campus Police.
And you see it, all the chiefs in Winnebago County working together on this issue. So that's a great thing. To see the hospitals collaborating is something that I thought I would never see, and that's awesome.
Right. And the reason that we would not necessarily expect it is because of those HIPAA rules.
Absolutely.
It's not because they don't want to.
Right.
It's that they're regulated against sharing information many times. Mm-hmm. And so we want to make sure that, and they found ways to be able to do that by taking names and things off of information, but then being able to share just the data. So you mentioned, Sarah, the Facebook page, and so people can like us on Facebook and learn more.
Yes.
And we just recently held another event where we really talked about our successes so far and pretty much laid out the new plan, the new...
Yes. So that was kind of our kickoff event and introducing our new steering team and action teams and our call for help to the community and talking about the successes. And I know one major success was the Rethink Addiction Run that came out of the Prevention Committee. That fund has been instrumental in bringing people together in the community. It's a healthy event. I know a lot of people in recovery and treatment and community members have signed up. We had almost over 1,000 people for a 5K and a 7-miler last year. So this year in September we'll have another event, and we're looking forward to seeing lots of community efforts in that.
That's good. And there are a couple of other initiatives. We have this Law Enforcement Addiction Assistance Program called LEAP.
Yes, this is a program that's Dean Smith, the Chief of Police in Oshkosh, as well as Sergeant Joe Framke, who runs his narcotics unit. They're modeling after what Appleton's been doing and also what they started out on the East Coast.
So that was going to be my other question. We're learning from other communities.
Absolutely.
Yes.
Okay. It's exactly what I was saying earlier, is that this is a way to get addicts into treatment rather than incarcerating them. And that's a good way to get a good segment of the population that's causing some issues treated and out of the picture. So this is a way to get treatment to people that want it. And law enforcement's taken the lead on this, and it's working so far. It's having success on the East Coast, and we're waiting to see if it's going to have success here. And I'm assuming it will in this region as well.
I think if we're as committed as we sound, we should be successful. Mm-hmm. We also have worked with the District Attorney's Office, and there's one other one I was just thinking of that we've been working with. It'll come to me. Sarah, how are we getting parents engaged and getting their support?
I think we actually have a parent on our steering team that is pretty instrumental, and she's reaching out to parents in our community and just having the conversation and kind of guiding them where to have support if they do have a loved one that's suffering, if there is treatment that's wanted, how it can be attained. I know that there was the Real Happy Hour, I believe, that was introduced from the Heroin Task Force, and that's just families coming together, having a meal, and having that conversation about how was your day, what did you do during the day with your kids, and just everybody kind of taking a moment to reflect, together on where they're at. I think in this day and age, you have a lot of single parents running the home, and you have a lot of people with all these different activities, and I think we're running here and running there and forgetting to take a moment and just regroup together as a family unit, which is very important in, I think, young and old people's development.
Right, and it's a good time for families just to reconnect and maybe slow down. I mean, I've heard of families saying no electronic devices at the table any longer during the Real Happy Hour. This is the time just for us.
Yes.
And it's also, I think, time to share a healthy meal. Because sometimes, when you said families are on the run, they're stopping in fast foods and picking fast foods up. We're going to shift gears just a little bit and talk about what you do in your other lives.
Yes.
So, Sarah, you're with Nova.
Yes.
And let's talk about what Nova does.
So we are a 28-day residential program. We're a 50-bed facility. 10 of our beds we're a 501c3. Our mission is the best quality care at an affordable cost.
Okay. And your programs, some of the things that you do?
We do have a residential program.
So how long would somebody stay in your residential program?
28 days.
Okay.
We are a medically monitored treatment facility. We have licensed counselors and mastered level clinicians, and we are abstinence-based.
Okay. And we had mentioned that it was 50-bed facility. What's the difference between Nova and Terra, or you're one and the same, but you just call Terra?
The Nova program is the 28-day residential facility. The Terra program is a 90-day program that which our clients can come and go and achieve work and kind of put their recovery tools to work.
Okay, and then just some pictures of your facility. It's very nice.
Yeah.
You're located out on Jackson?
Yeah, and so
Okay.
one of the things they talk about is Nova feels right.
Mm-hmm. And so I see that you've got areas for groups. What is the picture on the left? Is that
It's
your
just-
lobby?
Yeah,
Oh,
it's
it's
just
cool.
our entranceway. Everybody kind of comments, and it has inspiring words as people kind of enter the building on their journey.
And how do you measure results?
We collect data, and we take. We have somebody entering in information. A lot of our clients go to onward to treatment or to another level of care. About 40% of them, but. We're always taking that data in and what drugs they're using, how long they've been using, and things like that.
Okay. Well, Kurt, we kind of started with the whole issue of 9 out of 20 cities in Wisconsin are the drunkest cities in America, in the top 20. So let's talk about that and how it relates to some statistics with UWO.
Yeah, I mean, and Oshkosh was number 6, so that's not a good thing. I'm very happy to say that UW Oshkosh has very little crime. However, most of our incidents we deal with are alcohol related. And this graph just shows that of the incidents we've dealt with last year, 60% were alcohol related. And this is just really a reflection on not only this community, but also this state and what we're in right now.
But now, I'm going to go back to that earlier statement that you said about people driving through campus. Would that include them as well?
Absolutely.
Okay,
yes.
so this isn't just student data.
No, this is just student data.
Oh, this is just
This is
student
just
data.
student
Okay.
data.
So now we've got some history here, and we've got to be quick on this. But again, I apologize for it being small, but you kind of get the picture here.
Yeah, it's a 5-year glance at UWO and alcohol incidents, and it's pretty much stayed the same. So it's something we need to work on.
Okay. And then with drug-related deaths.
Drug-related, that's just incidents we haven't had any drug-related deaths. And
Oh,
we'll have
incidents, I'm
fingers
sorry.
crossed. But these are just incidents we investigated. It's 25% of our incidents were drug-related. So that is the majority of what we do at UWO. Police action is related to alcohol and drugs. So, with that statistics came out with the cities in Wisconsin, this should be a wake-up call. It's about time that everybody realizes that there's drinking issues in this area and this state, and if we don't do something about it now, things are only going to get worse.
Okay. And we're trying to do that through the Winnebago County Drug and Alcohol Coalition. We're trying to measure the data. Are we measuring the right stuff?
That's a good question, and I don't think we're fully going to understand that till we get all the data together and then do a good analysis of it and see where to start.
So again, if somebody wants to get involved, how would they get involved?
Our website is great. Just go to the website and you can sign right up to any committee that suits what you want to do or how you want to help. There's a lot of ways to help.
Okay, and again, in order to do that, they can contact us at the Winnebago DAC@gmail.com, or they can call 920-420-6831.
Yes.
Well, thank you for being on the program. I'm hoping that people really understand the significance and the importance of the issue that we're talking about today. It's a very tough issue to talk about. And thank you for watching our program.